Anxiety is a normal human response. Anxiety is the way our bodies prepare themselves to face up to a threat, either to fight the threat or to run away from it. So it's a normal response, and it's a protective response. Our ancestors would have survived because they were able to harness the anxiety to face and deal with the threats that were in their environment. Anxiety can become a clinical problem when it is excessive. That is, the threat is very minor, but our response is too severe, or when we feel anxious in the absence of a threat. What happens when we are anxious is a mixture of emotional and bodily symptoms. So emotionally, we feel fearful, we feel worried. It's a round of painful thoughts that go on and on in your head, which you can't switch off. And you feel apprehensive that something terrible will happen. Bodily, you can feel that your heart is pounding, your hands are shaking, your throat is dry, you can't get enough breath, your stomach feels a bit unsettled, you have pins and needles, you may feel a bit giddy, you may feel you're going to fall down. There are 5 main kinds of anxiety disorders: generalized anxiety, panic anxiety, social anxiety, phobic anxiety, and obsessive compulsive disorder. In generalized anxiety, you tend to worry about all kinds of things all the time, even when there is no threat present. In panic anxiety, you have a short-lived but very severe episode of anxiety with a sense that something terrible or catastrophic might happen to you. Panic can be very distressing, and people have stopped going out to places where they fear they might get a panic attack. Phobic anxiety is an irrational fear of something specific that you then start avoiding. Social anxiety is feeling anxious in social situations where you deal with other people. It's more than shyness. It is actually quite a distressing sense of not being able to be with people, and then you tend to withdraw from others. Obsessive compulsive disorder is a condition where you have to constantly check whether you have completed the tasks that you know that you have done, but you worry that you may not have done them to completion, like washing your hands or checking locks. And this can also be very anxiety provoking. Regardless of what kind of anxiety you have, very effective treatments are available for all of them. So you don't have to suffer in silence. You don't have to feel that you should be able to cope with this on your own, or you cannot talk about it to anyone. The 2 main forms of treatment that are available are talking therapies and medication. Most people with anxiety disorders will respond to talking therapies. Here, a therapist will sit down with you, work out what's making you anxious, and help you change your ways of thinking or looking at the world and behaving so you can master your anxiety. Sometimes people need medication. These medicines are safe, they are quite effective, and you need to take them only for a short time, and then you will get better. So regardless of what is making you anxious, please do seek help, and you will feel much better.